guys, welcome to Health Matters, where we get expert opinions on questions you're wanting to ask healthcare professionals. We are in conversation with Dr. Roma Sarnaik, a new age lifestyle medicine physician who counsels people to lead a disease-free healthy life. So if your goal is to imbibe a healthy living this year, pay attention to the tips and tricks that she has for you. According to the Global Nutrition Report, India is way behind the targets. So what do you think? Why is that?
That global nutrition report, they had planned to they had planned some targets to be achieved by 2025, and India is among the 88 other countries who is still running behind to meet those targets. And so just to mention what those were to the viewers. See, India has made no progress towards achieving the target for wasting. Wasting is basically undernutrition among the children, which is very prevalent in rural areas in India. Then almost 17.3% children under 5 age group years wale are affected in India, which is higher than the average for the Asian region in total, and one of the highest among in the world. India has shown limited progress towards achieving diet-related non-communicable diseases targets, and no progress has been shown towards achieving the target for obesity. So as you can see, we are talking about malnutrition and wasting and obesity simultaneously. So there is a group of population who is undernourished, and there is a group of population who is eating more, who is maybe eating more or not physically active enough and are overweight. So there is two sides of the story in the same country. So we have to tackle both the things together. The main reason for this is inequality. The inequality is in the terms of financial condition, in the terms of available resources, in terms of education, and you just name it. There is inequity amongst everything, among every aspect of life, which I think is one of the main reasons. So obviously, to tackle this, action needs to be taken on a political level. Obviously, we need to have teams working around this. At India, we are like, our country has the highest rate of domestic inequalities in malnutrition. Also, we are going to miss all the 4 nutritional indicators for which there is data available for the Global Nutrition Report, including stunting among under 5 children, anemia among women of reproductive age, childhood overweight or obesity, and exclusive breastfeeding in food and health system as well in India. This exacerbates the inequalities in nutrition outcomes that in turn can lead to more inequity, which perpetuates a vicious cycle. So if you ask me, for a solution to this, the main thing will be awareness. Raising awareness. We need to have more teams working around nutrition and lifestyle in our country, and we as individuals have to do whatever we can on our level. Like, I am trying my best to raise awareness and counsel my patients. So like, for example, you are interviewing me, and you come from a totally different professional background, but I am sure after hearing to whatever I told you, I'm sure you might mention this to some of your friends, or maybe some of the to-be parents or parents whom you might know about the importance of breastfeeding. Like, for example, if your friend is pregnant or breastfeeding, you might tell her. So this is how we at individual levels have to do whatever possible from my side, I think. And also, there's a lot of behavior change resistance in our country. We as Asians are most prone compared to the other countries to behavior changes. So I'd explain it through an example. So for example, for a few of my clients from the UK, when I told them, so like, for example, let's talk about an obese client. So when I told her about the harmful effects of high fat food that she was consuming on a regular basis, and I told her how harmful the skin of the meat is and that you have to remove it, and she loved the skin of the meat. She never used to trim it off. After I told her, she was genuinely worried. She genuinely was worried about that she has been consuming it since so many years, and see what have I done to my health. And she actively took steps. She actively took my support and my help in lowering her fat and chicken meat intake. Now, take another example. I have a patient in India. He is hypertensive. I told him the same thing. He listened to whatever I had to say, and then he forgot. So it didn't matter to him, But when I told him, when he was sitting in front of me in my cabin, he did seem like he was worried. But he didn't take it seriously. You know what I mean?
Yeah.
So that is what I mean. Resistance to behavior changes. And we Asians, all the Asians are more resistant compared to other countries. So even when after, let's say, we spread awareness, we do whatever we have to do. But what after that? What next? People have to do something by themselves, na? Like in India, Hindi में कहावत है कि हम घोड़े को पानी तक ले जाएंगे, but पानी तो उसी को पीना पड़ेगा. Right? So if a ghoda is thirsty, we take him to the lake, he has to drink the water. Now how can we drink the water for him? So this is a very big barrier, and there are so many reasons behind it. So I think we have to work around this as well, and I think it has to do more with counseling. So that is why, when I practice, along with consultation, I do counseling as well. So only providing a diet plan or only telling my client what to do is not going to make him or her healthy. I have to counsel them. I have to help them maintain, sustain those changes, achieve them, support them. Because, maximum people, as you might know, follow a routine for a few days, let's say a month or two, and then we get off track, which is very natural. So staying on track and sustaining those changes is very important, I think. So I think, counseling is very important. More people need to take up counseling in a country. More people need to take up this responsibility to educate people as well. And I also think that children and women, they are the change makers in the health status of a family, because children are open to new ideas. They are open to new perspectives. They learn whatever we teach them. Yeah. And sometimes children are the ones who, explain new concepts to their families and parents, because the older generations, there's a typical trend which goes on, especially in our society, and they don't think outside the box. They don't think outside of their own zone and their own thoughts. So I think educating children and helping them realize the importance can in fact make them go and help change their family members. And women, because I think in India, there are men who cook, but I think women are the one who run the household. They do the cooking part, etc. And nutrition, cooking are like almost related, and making them aware about, how, for example, we spoke about not reheating the oil. So educating women about not reheating the oil is going to not only help the particular woman, but her children, her family, her in-laws, and everyone. Yeah. And even she can educate others.
That just brings me to the next question as to how can our audience, improve and manage their nutrition requirements?
Yeah. So like I told you, it's all about a balance. Never try to go for extreme diets or extreme exercise plans or anything extremes in life. It's all about the balance. So the choices you make about what you eat or what you drink matter, okay? They should add up in total to a balanced, nutritious diet. So let's say, for example, today you ate a pizza and you ate, a cake or whatever dessert. But the rest of the week, you had almost all the days of the week, you ate nutritious food. So overall, that is a balanced diet. So that is how we have to look at it. So there are going to be times when we can get off track, but what we have to aim is to have majorly a balanced diet most days of the week. And we all have different calorie needs based on our age, sex, and activity levels, and health conditions have a very big role as well. For some of us have some underlying health conditions, some of us do not. So it's different for everyone. A balanced diet is one where you eat a wide variety of mostly healthy foods, but in moderation, like I told you. And there's a big difference between eating well and becoming obsessive about calories, portion sizes, and clean eating. Being healthy isn't just about the way you look or how much you weigh. So all these things are must remember for everyone. and no food is off limits when you maintain a healthy diet. It's just a question of how often you eat it and how much of it you eat. So don't overthink, and definitely don't feel guilty if you eat a piece of cake or a cookie occasionally. That's all right. Few tips would be, to always stay hydrated, drink water. Water constitutes 60% of the human body. So when you feel thirsty, your hands down best choice is water only. Treat soft drinks, energy drinks, and even juices as occasional treats. You can occasionally have it. We are not asking you not to have it occasionally. Then don't fear fats. Like I told you, fats are bad for our health, but some amount of fat is essential. Just don't overdo it. So it's not about eating or not eating a food, it's about moderation. So fats are obviously a part of healthy diet, but not all fats are the same. Like we spoke about olive oil and those trans fats on the eating. Unsaturated fats, like those found in avocados, nuts, and olive oil, should play an important role in your diet. Have in moderation. Avoid saturated and trans fats, like we spoke about, found in butter, fried food, pastries, cakes, as much as possible. Cut down on sugar. Sugar is very harmful. And in 2015, the World Health Organization made a strong recommendation that adults should reduce the sugar intake to less than 10% of their total calories, total daily calories. So that's how harmful sugar is. And as a rough guide, this means fewer than 10 teaspoons of sugar per day. So all those who are listening to me right now, just try to estimate how many teaspoons of sugar do you have each day. It should be less than teaspoons. And teaspoon is the small one, tablespoon is the large one. So less than 10 teaspoons of sugar per day, always remember. And if you're having 6 to 7 teaspoons per day, that does not mean that you have to take it up to 10. The less sugar you consume, the better for your health. And just one can of soft drink contains this amount of sugar. Like if you have one can of soft drink, let's say Coca-Cola, Mirinda, or whatever, just one can has this amount of sugar, which is the daily recommended amount, that is 10 teaspoons. So basically, if you have one can of soft drink, you cannot consume sugar the whole day. That's how harmful it is. Yeah, so you have to see that you've got to keep a close eye on all the sweet stuff that you eat. And if you want to change your eating habits, you'll need to have the right attitude. Okay. So I have a few tips on how to approach eating well for you all. The first one is, don't try to change your eating habits completely right away. You have to always make it a gradual process. So don't plan to stop eating sweets from tomorrow. You cannot do that. Make it gradually. So let's say you eat sweets only alternate days a week for a few weeks, and then you go to maybe twice or thrice a week. So gradually you have to make changes, any kind of change. Second one would be to start with achievable goals, like having one piece of fruit every day or adding salad or veggies to a meal. So let's say you stick with your current routine, and just if you're not consuming fruits, you can just add one fruit each day for a month, and you can keep adding one new healthy habit each week or each month, and that's quite workable. And experiment with various healthy foods and see which ones you like. Okay, the world's greatest chefs know that healthy food doesn't mean flavorless food. So that is a misconception, that healthy is flavorless. No, there are so many options. It's just that we are not aware about it. And I myself, I have been a very big foodie. I love food, and I was a person who used to think why is all that I like so unhealthy? Why can't I eat my favorite food? But I have been working on recipe reformulation. When I was in the UK, I worked at Jamie's Ministry of Food in Leeds. So they basically are healthy cooking. They conduct healthy cooking classes. So they taught us, like we taught people how to cook their favorite food items, but you have to just change the quantity and content and ingredients accordingly to make it a healthier dish. So even let's say you're having a carrot cake, it doesn't have to be unhealthy. You can cook a healthier version as well. So each recipe has a healthier version. So you have to actively do that. You have to actively find out, how can I make this healthier? How can I make my gajar ka halwa healthy? How can I make this gulab jamun healthier? There are options. Okay, there are options. And if you can't there are always people to support. There are nutritionists to support you out there. So yeah, seek help, try your best, and always allow yourself with occasional treats. Don't do extreme diets, because again, physical and mental health both are interrelated. If you starve too much, if you do extreme diets, it's going to affect your mental health. If you go totally off carbohydrates, like a few people recommend, it's going to affect your mental health. And especially for students and youngsters, who try to do dieting, all those kinds of fads, it affects our academic performance, it affects our motivation, concentration, और पढ़ाई में बहुत affect होता है. So try not to do that. At the same time, try not to overconsume sugars and other. There's one point which I would like to highlight if there's any student or youngster watching this podcast. So what happens is, all these sugary products, donuts, vagara, all that we like, what happens is, let's say there's a graph. So why do you feel so good after eating your favorite food product or a dessert? So what happens is, it suddenly shoots our blood glucose levels. So as soon as you have a dessert, let's say a gulab jamun or an ice cream, your blood glucose levels is going to shoot. So let's say this is a graph, it's going to shoot. Okay, so you feel good, but then it falls down equal suddenly. Okay, so what happens is, once we finish one scoop of ice cream or one gulab jamun, we suddenly want the next scoop or next gulab jamun. We are not satisfied. So if you rewind and think about the times that you have sat and overeaten something, you'll realize that when you're in the active process of eating, you feel good. But when that food item finishes, you feel sad. You want more. Why is that? That is very bad for your brain, because your blood glucose levels are shooting suddenly and then they go down again, and it's very bad for your mental health. So try not to do that, and go for the food options which I have mentioned. I've given quite loads of tips on nutrition in this video, I think in question number 2 and 3. So go for food items that make you feel full for longer. So for example, I spoke about whole grains, etc. What these food products do, the healthier ones, is that your blood glucose won't shoot like this, but it will shoot like this, and then there'll be a plateau phase before it drops down again. That is what is healthy for your body and your brain. So if that makes sense. So that's the reason we need to choose healthier food products. So it's not about just physical health, but it's about our mental health as well. And and we spoke about beverages, how not to drink too much alcohol, and try to go with water and non-sugar sweetened beverages. And I think I've almost covered everything about nutrition in this answer.
Yeah. Thank you, Dr. Roma. It was really lovely talking to you. And I think everything that we've spoken about, all the tips that you've mentioned, will be very helpful for our audience. And I hope that even I myself am able to inculcate all the alternative choices that you've mentioned.
Guys, if you enjoyed the discussion, don't forget to like, share and subscribe. Also, turn on the bell notifications and comment down any questions related to health and wellness, and we will try to answer it in our next episode.